Mesh is a synthetic material. Your body grows on it, incorporates it, and becomes part of you, kind of like when trees grow into fences. As any surgery that we do, with or without mesh, and as any foreign material that you deal with, there is always a chance of infection. The chance of infection is really, really low. It's about 0.5%, especially with the newer kinds that we use. But it's still a synthetic material, it's still a risk of infection, and the patient should know about it. There's also other kinds of patch that can be used. We don't use them routinely all the time, but those are made of biologic material. If you use a biologic material, that's good because the chance of infection can even go lower. But biologic material will reabsorb and fall apart over time, and that may put you at risk of having another hernia. So we don't routinely use them unless the patient really wants a biologic patch, which is totally fine, or unless we're bailing out in an emergency situation. This is something that I go over my preoperative consultation 100% of the time. I do not end a consultation without talking about mesh, the risks, the benefits, and really what we can do with that.